This all started in 2006 with a renal cell carcinoma. Removed and everything was fine and dandy until this year that they found a little nodule on my lower lobe of my right lung. And then also they found what I have on my right kidney right now, and that's why we're here. I have learned a lot of things about my family, my wife, and myself. I didn't think I was going to get through all this. I'm here.
My name is Gandhi. I'm an interventional radiologist specializing in treatment of tumors, also known as interventional oncology. I've been in practice for over 15 years here at Baptist Health, South Florida. We would do our procedures here at Miami Cancer Institute and Miami Cardiac and Vascular Institute, and we're really at the forefront of technology when it comes to treatment of patients with minimally invasive procedures. This is a 68-year-old gentleman who had a history of a renal cancer in his left kidney, and that was diagnosed in 2006. And at that time, a patient underwent a complete nephrectomy, so the entire left kidney was removed. Last year, he developed some metastatic disease from that renal cell cancer. He had a metastasis to the lung, which was resected, and also one to the pancreas, which was removed. And then now he basically presents with a renal mass, an enhancing renal mass in the right kidney, and our job is to treat this cancer. We use the Epione robotic system, which is, in my experience, really the most advanced technology that we have for percutaneous tumor ablations. The benefits of the Epione robotic system is it allows us to treat patients more precisely. We're able to access lesions which sometimes would take us hours, or sometimes we couldn't treat at all. With the robotic system. It allows us to treat patients who might have a lot of issues, might have a lot of comorbidities, who might not be safely placed under anesthesia for a long period of time, where you can treat the patient much faster and you can do it safely. And finally, we haven't seen any major complications from the technology itself. So to us, it's really been a game-changing technology. Another real benefit of the robotic system is that it allows us to utilize out-of-plane imaging. So basically, we can enter the patient's body at one site and basically treat in a completely different location while being able to follow that needle very closely. And that's another very nice benefit of the robotic system. So here we're looking at, this is the 5-minute images after we started the cryoablation. We used the Epione robotic system to get this cryoablation probe. It looks really well positioned here. And if you look here, this dark area here, I could probably mag up even more on it, is the actual ice bowl. And what's very nice about this is we can actually monitor. So we want to, there are some nerves that run along the ribs here. We're looking to make sure that we're not going to cause any injury there. We want to make sure that we're covering the entirety of the tumor, but this looks pretty good here. When we're doing procedures robotically versus freehand, these procedures are done much faster. It's really beneficial for everybody. Beneficial for the patient, as the patient's under anesthesia for a shorter period of time. We're able to do more procedures in the room, and patient, can have a faster recovery as well. This is the state of the art in robotic technology, and I've had, some people from other institutions say, hey, I don't need that. And, I have to tell you, I was a little skeptical at first too. I'm like, hey, do I really need this technology? I'm pretty good with my hands. But I've realized that, I've been doing this for over 15 years, and this is a game changer. And I realized this, it didn't require 10 cases, it didn't require 5 cases. Within a couple of cases, I realized really the benefits of this technology. Results fantastic. We got the probe exactly where we needed it to be. Given the size and location of the lesion, we were able to treat the entire tumor with just one ablation probe. And the outcome looks really good. In terms of recovery, there's a potential for faster recovery as well. Again, shorter the patient is under anesthesia, the better it is for the patient. And this should be completely curative for the patient.
It's awesome. I think it's awesome. I think if it would have been because of that, I'd probably be in the hospital for a couple of days more, or maybe a whole week. I feel relief. Hopefully from now on, I don't have to come back. I think I haven't released some life since we began with all this.